Welcome to the final video in this four-part video series on understanding metabolic syndrome and treatment options in patients with type 2 diabetes, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes and metabolic syndrome. In this fourth video, we'll review a case study to discuss diagnosing and treatment options for a patient who may have metabolic syndrome. You can watch each video in order or based upon your interest. The objective for this video is to learn the process of assessing, diagnosing, and treating a patient who may have metabolic syndrome. Our hope is that after this video, you will understand how you can make a difference without saying a word by assessing your patient starting with your eyes to identify some of these chronic diseases that may be going undiagnosed. Mr. Jones is a 68-year-old white male. He is 5 foot 10 inches tall, and his chart says he weighs 180 pounds. His wife recently passed away, and he's wanting to come in for an annual physical just to make sure he's healthy. His past medical history includes hypertension, stroke, COPD, sleep apnea, hyperlipidemia, and non-alcoholic fatty liver. His family history consists of a father with type 2 diabetes, hyperlipidemia, and a bit of hypertension. So I walk into the room and I'm looking at the patient and I say, "Hello, I'm Dr. Newman. How can I help you, Mr. Jones?" And Mr. Jones says, "I'm here for a physical." But before I say anything more, here's what's going through my mind, just based on his appearance. So I'm making this visual observation. I'm noticing his waist circumference, and I'm thinking about ethnicity and wondering if he has diabetes. Maybe I'm thinking he might have some fatty liver. His medical history says so. Some hypertension. We know he has cardiovascular concerns. And maybe now I'm starting to go down that road of risk of a stroke. And I'm really worried about his kidneys. So I ask him how he's doing, if he has any complaints or any issues that he is concerned about. And Mr. Jones says, "No, I have absolutely no complaints." But I'm thinking, well, he has high blood pressure. I can see his waist circumference is pretty big, so I should really measure that. He has chronic kidney disease. I know he has type 2 diabetes, and I'm not sure about his kidneys. So because he's here for a physical, I might need to maybe expand my visit. And again, worried about stroke and cardiovascular things. So on exam, his weight is actually 264 pounds, and he is 5 foot 11. His blood pressure is 160/90 with a heart rate of 90. The abdomen is a bit above the level of his chest. His liver is a bit enlarged on palpation as well as his spleen, but all other findings are okay. And using this case study, I'm using motivational interviewing, patient-centered care, and patient engagement, and active listening. So I started asking him some probing questions. Tell me about your daily routine. And he says, well, I get up, I have coffee, a piece of toast, and some bacon. So I ask him, do you get out much? I mean, do you get out of the house? Do you go outside, do things? How active are you? And he says, he really doesn't get outside too much. So I ask him about his activities of daily living. Can you take a shower? Can you dress yourself? Do you do your own laundry? And he responds, yes, I can do most things. So after my evaluation, I order labs. I also want to do an abdominal ultrasound, look at his eyes. Part of that lab work, I want to look at his thyroid. I also want to do a bone density EKG and do a polysomnography, which is also known as a sleep study. So here's what comes back. His A1C is high at 10%. His liver tests are high, ALT of 134, and AST of 74. I'm a little bit worried about his HDL, which is low at 30. His potassium looks good. Fasting glucose is high at 163, so he definitely has diabetes. His GFR is 40, so I'm a little bit concerned about that as well. And his sodium is okay, not great, but okay. So on the ultrasound, the liver is normal size, which is great, and the spleen is okay. He does have a little bit of enhanced reflex, which I'm leaning towards glaucoma there. His thyroid looks good, bones look good, his EKG looks great, but look at his sleep study results. He has sleep apnea, which is a major risk for stroke. And he has all of these other things going on with diabetes, some chronic diseases, metabolic syndrome for sure. And he has mixed sleep apnea, also known as complex sleep apnea. It's a very rare sleeping disorder that occurs when someone experiences both central and obstructive sleep apnea. So central, that's the area of the brain that controls breathing, and can result in you just to stop breathing. The obstructive part, has to do with the airway, and it can be partially or completely obstructed. Hypopnea, the result was 189, which indicates a very severe case of sleep apnea. It means you're experiencing 189 episodes of shallow breathing per hour of sleep. His average oxygen saturation is 94, but the lowest rate was at 82%, and people are intubated when they reach 82. So not good at all. So here are Mr. Jones's diagnoses after all these tests. And this is a patient who came in just for a physical with no complaints. He has non-alcoholic fatty liver, chronic steatohepatitis, and that's developing into cirrhosis. Hashimoto's disease, that's a chronic autoimmune disease that attacks, it just means your autoimmune is attacking the thyroid gland. Obesity, hypertension, hyperlipidemia, however, it is under good control. Type 2 diabetes, chronic kidney disease, and he has a very rare and risky form of sleep apnea. So, Mr. Jones comes back to, we're here to review your results, and he says, how did I check out? I feel great. Well, I unfortunately have to tell him we have some things we need to tune up. So here is the treatment plan. So he needs to see a nutritionist or dietitian to come up with a diet plan. He needs a formal exercise plan. He needs to be on a statin, if not already, for his hyperlipidemia. Of course, he needs a diabetes medication based on his A1C and his fasting glucose. He needs to see a registered dietitian, which we mentioned for the nutrition prescription. Beta blocker for his hypertension. He did have he needs a glaucoma screen by an ophthalmologist who can further diagnose any potential eye problems. A podiatrist, an ACE inhibitor such as lisinopril, and he needs to be seen every 3 months. So in summary, metabolic syndrome has serious implications, as we've just seen with Mr. Jones. It can affect not only their health, but their budget. It can be very expensive to treat. So it's necessary to recognize the rising prevalence of metabolic syndrome. Through intervention, the progression of the syndrome can be halted and potentially reversed. He may be predisposed to metabolic syndrome, but we still have a voice in it, and it is something that, he has a voice, but this really needs to be addressed. We need to help him, educate him, and guide him. We also need to be very transparent so that he understands the health risks and what could happen down the road if changes aren't made. Certain, things they just can't wait. Here are some resources and tools to learn more about metabolic syndrome and diabetes care. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.